Alright, let's dive into something that's been making headlines recently, and honestly, it's a topic that hits close to home for a lot of us. We're talking about the mental health crisis in England, and the recent news that millions of people might face even longer waits for care as NHS providers plan cuts. Now, before we get into the nitty-gritty, let me just say this: mental health is one of those issues that affects everyone, either directly or indirectly. So, when I heard about these potential cuts, my first thought was, how did we get here, and what does this mean for the future? Here's the deal: according to a Guardian report, over two-thirds of NHS mental health providers are planning to cut services, and half are expected to reduce staff. Personally, I think this is a massive red flag. Mental health services are already stretched thin, with demand soaring like never before. What makes this really interesting is that these cuts aren't just about numbers, they're about people. We're talking about child and adolescent mental health care, talking therapies, addiction support, and crisis intervention. These are services that, in my opinion, are already underfunded and overburdened. Cutting them feels like putting a band-aid on a bullet wound. Now, let's take a step back and think about the bigger picture. Prime Minister Andy Burnham recently announced plans to create nearly 200 community mental health centers by 2029. On the surface, that sounds promising, right? But here's the catch: if funding for staff and services is being slashed, how are these new centers supposed to function effectively? From my perspective, it's like building a house without laying the foundation. Mental health charities have pointed this out too, saying that meaningful improvements will be impossible without proper investment. And I couldn't agree more. One thing that immediately stands out is the disconnect between ambition and reality. We've got these grand plans for the future, but the present is crumbling. NHS professionals are already warning that these cuts will make it impossible to provide safe and effective care. An anonymous consultant psychiatrist said it's not just an isolated issue in East London, it's a nationwide problem. What this really suggests is that the system is at a breaking point, and the people who suffer the most are those who need help the most. What many people don't realize is that mental health isn't just a personal issue, it's a societal one. When mental health services are underfunded, it has a ripple effect. It impacts productivity, it strains families, and it puts additional pressure on other public services. If you take a step back and think about it, cutting mental health funding isn't just a cost-saving measure, it's a short-sighted decision that could end up costing us more in the long run. Sharon Graham from the trade union Unite put it perfectly: you simply kick the can down the road and it costs more in the long term. Now, let's talk about the numbers for a second. The government claims they're investing a record £16.1 billion into mental health services this year, and they've recruited over 8,500 additional mental health workers. That sounds impressive, right? But here's the thing: when you consider the rising demand and the fact that the share of national NHS spend on mental health is expected to reduce for the third year in a row, those numbers start to look a lot less reassuring. In my opinion, it's not just about throwing money at the problem, it's about allocating resources effectively and sustainably. This raises a deeper question: why is mental health always the first to get cut when budgets are tight? Is it because it's less visible than physical health? Or is it because there's still a stigma around mental health that makes it easier to ignore? Personally, I think it's a combination of both. But what's clear is that we need to start treating mental health with the same urgency and importance as physical health. Because, at the end of the day, they're two sides of the same coin. A detail I find fascinating is the focus on community-based care. The idea of neighborhood mental health centers is great in theory, but without the staff and resources to support them, they're just empty promises. Tom Pollard from Mind hit the nail on the head when he said that meaningful improvements will be impossible without proper funding. And that's the crux of the issue: we can't keep announcing ambitious plans without addressing the fundamental problems in the system. So, where do we go from here? In my opinion, we need a complete overhaul of how we approach mental health funding and care. It's not enough to just throw money at the problem or announce new initiatives. We need a long-term strategy that prioritizes prevention, early intervention, and sustainable funding. We need to listen to the professionals on the ground who are warning us about the consequences of these cuts. And most importantly, we need to recognize that mental health is not a luxury, it's a necessity. As I wrap this up, I'm left with a thought-provoking question for all of us: what kind of society do we want to be? One that prioritizes profit over people, or one that recognizes the value of every individual's well-being? Personally, I know which one I'd choose. But it's going to take more than just words, it's going to take action. So, let's keep talking about this, let's keep pushing for change, and let's make sure that mental health gets the attention and funding it deserves. Because, at the end of the day, it's not just about saving services, it's about saving lives.